Did you know that prostate cancer is the second most common cancer among men worldwide? Every year, around 1.5 million men are diagnosed with this silent threat, and tragically, many discover it too late. Here's the alarming truth. Prostate cancer doesn't always announce itself with obvious symptoms like painful urination or blood and semen. Instead, it often whispers through subtle, almost unnoticeable signs that most people miss. In this video, we're uncovering 8 early warning signs of prostate cancer that could save your life. Some of these signs might surprise you because they're not the ones you commonly hear about. That's why it's crucial to watch closely. But we won't stop there. Before the video ends, we'll also share 6 scientifically backed tips to drastically lower your chances of ever developing prostate cancer. Think about it. The difference between early detection and late-stage diagnosis can mean an astounding 98% survival rate. Don't let dangerous assumptions, like "I'm too young," "I'm healthy," or "it won't happen to me," put your health at risk. Your health and future are worth every second of your attention. Let's dive in, starting with some of the most overlooked warning signs that could make all the difference. 1. Weak or interrupted urine flow. Weak or interrupted urine flow is often recognized as an early warning sign of prostate cancer. This symptom occurs due to the prostate gland's location and its relationship with the urinary system. The prostate sits just below the bladder and surrounds the urethra, the tube responsible for carrying urine out of the body. When prostate cancer develops, the abnormal growth of prostate cells can lead to the enlargement of the gland. This enlargement can compress the urethra, narrowing the passageway and causing urine to flow less freely. The weak or interrupted urine flow happens primarily because the growing tumor obstructs the urethra, a condition referred to as urethral obstruction. This mechanical narrowing of the urinary pathway creates difficulty in urination, often resulting in a slow or weak stream. Over time, the chronic obstruction can also impair bladder function. The bladder may not empty completely or may require more effort to push urine through the constricted urethra, leading to symptoms such as hesitancy or intermittent flow. In some cases, advanced cancerous growth may invade nearby tissues, further exacerbating urinary issues. 2. Fatigue or general weakness. While fatigue and general weakness can be signs of many different conditions, such as nutritional deficiencies, heart disease, diabetes, and kidney problems, these symptoms can also be linked to prostate cancer, especially as the disease progresses. Fatigue and weakness are commonly reported by individuals with cancer, and prostate cancer is no exception. In the case of prostate cancer, these symptoms are often a result of a combination of factors that impact the body's ability to function optimally. One of the primary causes of fatigue in prostate cancer patients is the cancer itself. As the tumor grows, it demands more energy from the body, leading to a feeling of persistent tiredness. Additionally, prostate cancer can cause changes in hormone levels, particularly a decrease in testosterone, which can contribute to feelings of fatigue and general weakness. Testosterone is essential for maintaining energy levels, muscle strength, and overall vitality. When prostate cancer affects the body's ability to produce or maintain normal levels of testosterone, patients often experience a noticeable decline in energy and stamina. Although fatigue and general weakness are not exclusive to prostate cancer, like I said before, when they occur alongside other symptoms, such as difficulty urinating, unexplained weight loss, or blood in urine or semen, they can be indicative of an underlying problem like prostate cancer. It is essential for individuals experiencing persistent fatigue and weakness, particularly when combined with other signs, to seek medical attention. 3. Unexplained constipation. You may not think that constipation could be linked to prostate cancer, but in some cases, it can be an early warning sign of this disease. While constipation is often caused by dietary issues, dehydration, or gastrointestinal conditions, it can also occur as a result of prostate cancer, particularly when the cancer grows large enough to interfere with nearby organs and bodily functions. Understanding this connection can help in identifying potential issues early on. The prostate gland is located just in front of the rectum, and as prostate cancer progresses, the tumor may enlarge and exert pressure on the rectum. This pressure can disrupt normal bowel movements, leading to difficulty in passing stool or a feeling of incomplete evacuation. In some cases, the tumor may even invade or impinge upon the nerves and muscles involved in regulating bowel function, further contributing to constipation. Another mechanism linking constipation to prostate cancer is the systemic inflammation caused by the disease. Cancer can lead to widespread inflammation in the body, which may slow down the digestive process. This slowing of bowel movements can result in harder stools and difficulty in passing them. Additionally, changes in hormone levels, such as a drop in testosterone, can affect muscle tone and function, including the muscles involved in bowel movements, thereby worsening constipation. While constipation is not indicative of prostate cancer, its presence, especially when persistent and unexplained, should not be ignored. 4. Pain while sitting. Sitting should be a simple, comfortable action, but prostate problems can turn it into a painful ordeal. When the prostate becomes enlarged, it can create pressure in the pelvic region, causing pain that might feel like a dull ache one moment and sharp, stabbing sensations the next. This discomfort often extends to the lower back, creating a nagging, persistent pain that can be difficult to manage. What's more, these sitting-related struggles might be an early warning sign of something more serious, like prostate adenocarcinoma, the most common type of prostate cancer. Each moment of discomfort isn't just an annoyance. It's your body sending signals that shouldn't be ignored. Understanding and addressing these clues early could make all the difference. 5. Swelling in the legs or feet. When prostate cancer progresses, it can turn your lymphatic system into a battleground, and your legs and feet might start showing the signs. That swelling you notice isn't just about a long day or extra salt in your diet. It could be a sign of something much more serious. The lymph nodes, which are responsible for filtering fluids and protecting your body from infections, can become blocked when cancer spreads to them. This blockage prevents proper drainage, leading to fluid buildup that causes noticeable swelling in the lower body. Persistent swelling in the legs or feet can be your body's way of waving a red flag. While it might have other causes, when it's accompanied by other symptoms, it could point to prostate cancer growth. Paying attention to these changes and acting quickly could make all the difference. 6. Unexplained weight loss. Significant weight loss does not happen by accident. It usually has an underlying cause that needs to be explained. While many people associate unexplained weight loss with conditions like thyroid disorders, diabetes, or gastrointestinal problems, it can also be an important early warning sign of prostate cancer. Recognizing this connection is crucial because unexplained weight loss often signals that the body is dealing with a serious underlying issue, such as cancer. In the case of prostate cancer, weight loss typically occurs due to a combination of factors. Cancer cells are highly metabolically active, meaning they consume a significant amount of the body's energy. As the tumor grows, it diverts nutrients and energy away from healthy cells, leading to a noticeable loss of body mass. This process, known as cancer cachexia, can result in not only weight loss but also a reduction in muscle mass and strength. 7. Erectile dysfunction. Before you say this is all nonsense, just hear me out. Yes, it's true that around 50% of men experience some form of erectile dysfunction, ED, and it's most commonly associated with factors like aging, cardiovascular disease, diabetes, or stress. However, erectile dysfunction can also be an early sign of prostate cancer, and understanding the connection could make a difference in catching the disease early when it's most treatable. The relationship between ED and prostate cancer starts with the prostate's location and its role in the male reproductive system. The prostate is situated near vital nerves and blood vessels that are essential for achieving and maintaining an erection. As prostate cancer develops, the tumor can grow and press against or invade these surrounding structures. This mechanical interference can disrupt the blood flow and nerve signals required for normal erectile function. In some cases, prostate cancer may metastasize to nearby pelvic lymph nodes or tissues, further impacting the delicate network of nerves responsible for erections. Advanced prostate cancer is particularly likely to involve nerve damage, but even early stages of the disease can cause subtle changes that contribute to erectile dysfunction. 8. Frequent urination at night. Under normal circumstances, most people only need to visit the bathroom every 3 to 4 hours during the day. But when prostate cancer begins to develop, you might notice yourself heading to the restroom far more often. These frequent trips aren't just inconvenient. They could be a sign that your prostate is changing in size or function. Things can get even more disruptive at night. Instead of enjoying uninterrupted sleep, You may find yourself waking up multiple times to urinate, a condition known as nocturia. While most adults can sleep 6 to 8 hours without a bathroom break, prostate issues can shatter this routine, leaving you tired and frustrated. Though aging and other conditions can also cause nighttime urination, frequent disruptions like these shouldn't be brushed off. They could be your body's way of hinting at a deeper issue, one that deserves a closer look by a medical professional. 6 scientifically backed tips to drastically lower your chances of developing prostate cancer. 1. Adopt a diet rich in plant-based foods. Numerous studies suggest that diets high in fruits, vegetables, and whole grains can reduce the risk of prostate cancer. Cruciferous vegetables like broccoli, kale, and cauliflower are particularly beneficial because they contain sulforaphane, a compound shown to inhibit cancer cell growth. Include tomatoes in your diet as well, as they are rich in lycopene, an antioxidant that has been linked to a lower risk of prostate cancer. 2. Maintain a healthy weight. Obesity is a known risk factor for aggressive forms of prostate cancer. Excess fat can increase inflammation and hormone levels, both of which contribute to cancer development. To maintain a healthy weight, focus on a balanced diet and regular physical activity, aiming for at least 150 minutes of moderate exercise per week. 3. Incorporate omega-3 fatty acids. Foods rich in omega-3 fatty acids, such as salmon, mackerel, and walnuts, have been associated with a reduced risk of prostate cancer. Omega-3s combat inflammation and promote overall prostate health. For a plant-based option, consider adding flax seeds or chia seeds to your meals. 4. Exercise regularly. Regular physical activity has been shown to reduce the risk of prostate cancer by improving immune function and lowering levels of insulin and inflammation. Activities such as brisk walking, cycling, or weightlifting not only keep your body healthy but also support hormonal balance, which is crucial for reducing cancer risk. 5. Limit red and processed meats. Research has consistently linked high consumption of red and processed meats to an increased risk of prostate cancer. These foods are often high in saturated fats and chemicals like nitrates, which can promote cancer cell growth. Replace red meat with lean proteins such as chicken, turkey, or plant-based options like legumes and tofu. 6. Get regular screenings and manage risk factors. Early detection is key to preventing advanced prostate cancer. Speak with your doctor about screening options, especially if you have a family history of the disease. Additionally, managing chronic conditions like high blood pressure, diabetes, and high cholesterol can significantly reduce your risk, as these conditions can create an environment conducive to cancer growth. By making these lifestyle adjustments, you can drastically lower your chances of developing prostate cancer while enhancing your overall health and well-being.